Hi, and welcome back to Physio Tribe. My name is Taher Dhuliawala, and I'm a senior neurological physiotherapist working at Physiofunction. So, in the last two videos, we talked about subjective assessments and objective assessments for treating patients with spinal cord injury. In today's third part, we will be talking about what all points to consider when managing patients with spinal cord injury and how to plan their rehabilitation. The ICF framework works best for planning and managing your patients in general for neurological conditions. However, I use that to help me identify and plan my management. So, initially, you assess impairments, activity limitation, and then participation restriction. So, for an example, if a patient comes to you with shoulder pain, then the activity limitation would be that patient is struggling to manage their wheelchair mobility, and that would have impact on patients' mobility in the community or patients self-propelling themselves for long distances on their wheelchair. So then this also helps you to formulate your goals and also helps you to identify and plan the treatment and the future management for your patients. Along with that, it also helps you to review and measure the outcomes. So, in management, I like to consider these following points, and the first and foremost is educating patient and their family. Usually when patient come to me, they have come from an acute setup, so patients are already educated about their condition, but then coming to the community setup could be quite overwhelming for patient and their family, because now patient is not living in the hospital bubble, they are living in the community, they're doing community stuff. So educating patients around those aspects and giving them um, realistic information, but also making sure that the patient as well as their family are not too overwhelmed by being in the community. So managing their expectations is very important again, and also making sure the family is not exhausted or their friends are not exhausted by doing too much for the patient. So having that boundary set up between family, what what their roles will be, what they will do for the patient, and also giving that time to the family by getting that formal package of care for the patients and helping them with their care needs. So again, our occupational therapist colleagues could help patients with that. And then managing patients' pain is one of the main pain could be one of the main complications after spinal cord injury, and managing that is very important. And physiotherapy is one of the aspects of managing pain, along with medications, surgical interventions, or psychological interventions, or even sometimes behavioral interventions. So need to consider those, and also managing from physiotherapy point of view, considering pain could be due to neuropathic problems, which could be different at different levels. So identifying that, and also pain could be due to musculoskeletal structures. So again, identifying that, for example, pain could be due to muscle spasms or sometimes shoulder pain. Now, managing the shoulder pain is essential because patient, depending on their level again, or regardless of the level, shoulder is one of the main important joint patient would be using. So if it is a low level injury or even thoracic injury, patients will be self-propelling themselves with a wheelchair, so they might end up doing a lot of repetitive activities. So identifying that, as well as patients sometimes could end up with some kind of impingement, or even because of weakness of rotator cuff muscles, patient can have pain around the shoulder joint. So again, identifying those problems and managing it by either strengthening exercises, your flexibility exercises on the shoulder. Sometimes patients tend to go into a protracted shoulder position, so stretching your pectorals really helps. And managing patient not to do too much of repetitive activity when the shoulder pain comes. Again, hydrotherapy works really best for pain management as well as managing painful shoulder. And I normally get my patients with spinal cord injury in hydrotherapy pool, because patients feel more they feel more independent, and they feel they can do a lot of things in the pool and in water. So preventing and managing contractures is a very crucial aspect of managing patients with spinal cord injury. And here you are trying to improve patients' quality of life by improving the flexibility of the muscles and also maintaining the joint mobility. So you ensuring to teach patients self-management technique by showing them self-stretching techniques, and also if patient is unable to do them, you teach patients family or their carers or their friends, whoever can do that with patients. I tend to teach my patients that I tend to suggest my patients three 30 minutes of stretching exercises 5 times a week. And if patient needs help with the preventing of their hand, to maintain the muscle length, I refer them for splints or even occupational therapists who can then look into positioning and other splinting advice. Skin management, pressure sores is very, very important again, and preventing pressure sores from happening. So educating patients to on pressure sores as well as their family is again important in managing patients with spinal cord injury, because once the patient is educated, they adhere to the prevention and management of their skin and for pressure sores. So teaching patients some self pressure relieving techniques. So if the patient is sitting in a wheelchair, teaching them how to manage by pressure relieving themselves. I normally suggest them every 2 hourly they have to do certain pressure relieving exercises. Again, it is depending on the level of injury. This is you change your advice to the patients, and also inform the family if obviously patient is higher level injury like cervical injuries, family or the carers who will help patients more for these techniques. So again, showing it to family is important, and also if the patient does or their family does regular stretches, that helps as well. I've noticed that functional electrical stimulation works really best for maintaining that muscle integrity and also to help with the hypertrophy of the affected muscles. And usually, FES around the gluteal muscles helps to increase the blood flow because patient is sitting on their bottom most of the day in either in the wheelchair or sitting in a chair, and so you need to maintain that blood flow in the gluteal muscles, maintain the hypertrophy in the gluteal muscles, because once the if this is not used, I've seen many patients getting atrophied. So FES helps usually with that. And also you can refer your patients for to occupational therapists who can suggest in some positioning and other pressure relieving techniques in the bed. So, and also occupational therapists can help patients to refer for pressure relieving equipments like cushions, mattress, and a hospital bed. So thank you so much for watching this video. In the next part 4 video, we'll be talking more about the management, and we'll be talking more about the role of how to improve motor task in patients with spinal cord injury. So make sure you come back for that, and please make sure you subscribe to our channel on YouTube with the Physio Tribe, and also follow us on other social media platforms. Thank you.